This is the pericardium enclosing the heart. Its base is below where it fuses with the central tendon of diaphragm, and its apex is above where it fuses with the vessels entering or leaving the heart. The position of its apex and base are the reverse of those of the heart, where the apex of the heart is below and its base is above. This is the pericardial cavity. Inside this cavity, there are two sinuses called the transverse and oblique sinuses of the pericardium. To demonstrate the transverse sinus of pericardium, put your finger from the right side in front of the superior vena cava and behind the ascending aorta and pulmonary trunk. The finger will appear on the left side. Behind the finger, there are the superior vena cava and both atria, which form the base of the heart. In front of the finger are the ascending aorta and pulmonary trunk. To expose the oblique sinus, just lift the apex of the heart, put your finger up behind the left atrium. This is the oblique sinus. With the finger in the sinus, the left atrium is in front of it, while the pericardium behind the finger, which separates it from the esophagus and descending aorta. This is the sternocostal or anterior surface of the heart. The base is formed by two atria, the right border by the right atrium, the inferior border by both ventricles. The right ventricle forms its right 2/3, and the left ventricle forms its left 1/3, including the apex. The left border by the left ventricle and auricle of the left atrium. The surface is divided by anterior interventricular groove, which is demarcated by a fatty line into right ventricle and left ventricle. The line is opposite the anterior border of the interventricular septum, and it watches the anterior interventricular branch of left coronary artery and the great cardiac vein. The uppermost part of the right ventricle is called infundibulum or conus arteriosus. It leads to the pulmonary trunk. This is the auricle of right atrium, projecting on the right side of the pulmonary trunk. This is the auricle of left atrium, projecting on the left side of the pulmonary trunk. The pulmonary trunk is anterior to the ascending aorta, close to the heart, but higher up it comes to its left side. At its end, it is behind where it divides into two pulmonary arteries below the arch of aorta. The right pulmonary artery runs to the right behind the ascending aorta, while the left pulmonary artery runs to the left below the arch of the aorta and in front of the descending aorta. This is the inferior surface of the heart. formed by the left ventricle in its left 2/3 and the right ventricle in its right 1/3. So most of the inferior surface is formed by the left ventricle, while the sternocostal surface is the reverse, formed mainly by the right ventricle. The two ventricles are separated from one another by the posterior interventricular groove, which lodges the posterior interventricular branch of the right coronary artery and the middle cardiac vein. This is the sternocostal surface of the heart, which is directed forwards. It is identified by the fact that the pulmonary trunk lies in front of the descending aorta, and that the two auricles project forwards, one on each side of the pulmonary trunk. To put the heart in the anatomical position, try to identify first the sternocostal surface, which is the anterior surface. Then the apex of the heart should be below and to the left, while the base is directed upwards. The base is identified by the pulmonary trunk and ascending aorta, as well as by the two atria. Now, you can identify the borders of the heart. This is the right border. This is the lower border. This is the left border. And this is the upper border. On the sternocostal surface, notice the two main grooves which start one on each side of the pulmonary trunk. The anterior interventricular groove starts on the left side of the pulmonary trunk, between it and the left auricle, and descends towards the apex of the heart to end a short distance to the right side of the apex. The groove lodges the anterior interventricular branch of the left coronary artery and the great cardiac vein. The great cardiac vein ascends in the groove and turns to the left in the atrioventricular groove, which separates the two atria from the two ventricles. Ultimately, it will end in the coronary sinus, which is a wide venous channel. This is the left part of the atrioventricular groove, as it curves onto the back of the heart, between the left atrium and the two ventricles. This is the back of the left atrium. And these are the left and the right ventricles. And this is the coronary sinus lying horizontally in the atrioventricular groove. It opens into the right atrium. Back again to the sternocostal surface. This is the right part of the atrioventricular groove, starting on the right of the pulmonary trunk, between it and the auricle of the right atrium. It passes between the right ventricle and the right atrium to continue on the back of the heart. It crosses the right coronary artery. This is the right coronary artery. It gives off the marginal artery at the lower border of the heart to run to the left along this border. On the back of the heart, the right coronary artery, posterior interventricular artery, which runs towards the apex of the heart in company with the middle cardiac vein. This is the middle cardiac vein. It also ends in the coronary sinus as the great cardiac vein. Both coronary arteries arise from the beginning of the ascending aorta. The right coronary artery arises from the anterior aortic sinus just behind the pulmonary trunk. It runs between the pulmonary trunk and the auricle of the right atrium. The left coronary artery, however, arises from the left posterior aortic sinus, that's to say, from the back of the beginning of the ascending aorta. It runs to the left between the pulmonary trunk and auricle of left atrium. Then it curves to the left in the atrioventricular groove. Where it gives off its anterior interventricular artery. Then continues to the left where it is called the circumflex artery. This is the back of the heart.